Hey everyone, and welcome. Today we are tackling a skill that is, no joke, one of the most fundamental things you'll do as a nurse, correctly putting on your personal protective equipment, your PPE. This isn't just about checking a box, it's about keeping your patients safe, and just as important, keeping yourself safe. So let's get right into it. Now, I know what you might be thinking. Putting on a gown and gloves? I got this. But here's the thing. The order you do it in matters a lot. One tiny slip up in the sequence can totally compromise your safety. It's not random. There's a real science to it. So stick with me and let's make sure we've got it down cold. All right, so here's our game plan. We're going to start with the why this is so critical. Then we'll get into understanding the different precautions, take a look at the gear itself, and then the main event, the step-by-step donning sequence. And finally, we'll cover what to do if an exposure actually happens. So first things first, let's talk about why this is such a big deal. Thinking of PPE as your first line of defense isn't just some catchy phrase. It's really at the core of what we do in healthcare. This quote really just says it all, doesn't it? PPE is a two-way shield. You're protecting your patients from anything you might be carrying, and at the exact same time, you're protecting yourself from anything they might have. It is the absolute foundation of infection control. So, who even makes these rules? Well, you've got two main players. OSHA is the one that defines what PPE even is. They're the ones saying it's essential safety gear. Then you have the CDC, who gives us the playbook. They do the research and tell us exactly what to wear, when to wear it, and how to wear it for maximum safety. Okay, so here's a key thing to understand. You don't wear the same PPE for every single patient. The gear you need is all based on the specific type of precaution that patient is on. Let's break that down. And right here, NCLEX alert. This is huge for your exams, but even bigger for your day-to-day practice. Standard precautions are the absolute baseline. They apply to every single patient, every single time, no matter what. Why? Because we have to treat all blood and body fluids as if they're potentially infectious. It's non-negotiable. Now, on top of those standard precautions, sometimes we need more. That's where transmission-based precautions come in. It all comes down to how a bug spreads. For contact precautions, think MRSA or C. diff, it spreads by touch, so you'll need a gown and gloves. For droplet precautions, like whooping cough, big droplets from a cough travel a few feet, so a surgical mask is your go-to. And for the really tricky ones, airborne diseases like TB, the germs are tiny and just hang in the air. That's when you have to use a special N95 respirator. Okay, now that we know the why, let's get to know the what. Let's dive into the tools of the trade, your PPE arsenal. First step, the gown. I want you to think of this as your body armor. It's got to cover your whole torso and have full-length sleeves. The opening is always in the back to keep the front clean. And hey, if you think things might get messy with a lot of fluids, you need to grab an impervious gown. That's the waterproof one. And listen, not all masks are created equal. A standard surgical mask is great for droplet precautions. It blocks those bigger particles. But for airborne stuff, you have to use an N95 respirator. And the most important thing to know about N95s is that you have to be individually fit tested for one every single year. If it's not a perfect seal, it's not protecting you properly. Next up, your eyes and face. And let me clear up a common mistake right now. Your personal eyeglasses are not enough protection. They just aren't. They have gaps all around them. You need proper goggles that fit securely against your skin. A face shield gives you even more coverage, but you've always got to wear a mask underneath it. And finally, we've got gloves. But before you even touch them, you gotta perform hand hygiene. Then always check for patient latex allergies. And the fit is everything. Too big and you've got gaps at your wrist. Too tight and they're gonna rip. We'll see in just a second how they lock in with the gown. And that brings us to the main events, the part you've been waiting for. The donning sequence. Getting this order right every single time is what makes the whole system work. It's a very deliberate process, and it's all designed to prevent you from contaminating yourself.
Feeling a little nervous about remembering the order when you're under pressure? I've got a great little mnemonic for you. Go make everyone glad. Just remember that phrase and you'll remember the order. Gown, mask, goggles, and gloves. It's a lifesaver in clinicals.
So here it is, the official order from the CDC. You start with the gown first. That protects your body and your clothes. Then comes the mask or respirator. After that, your goggles or face shield. And the very last thing you put on? Your gloves. See how it moves from the biggest items to the smallest? It's a system. So let's break that down. Step 1, the gown. Make sure that opening is in the back and tie it securely at both the neck and the waist. You don't want it flapping open or leaving any gaps while you're working. Okay, step 2, the mask. The most important thing you can do here is get a good seal. You've got to press that little flexible metal piece so it molds right to the bridge of your nose. Then pull the bottom down so it's covering your mouth and your chin completely. A mask hanging under your nose is doing absolutely nothing. And here it is, the final, crucial step. Gloves go on lest, and you have to pull the cuff of the glove up and over the cuff of your gown. This is so important because it creates a perfect, unbroken seal. No skin is exposed at the wrist. This is a step people miss all the time, so really burn this one into your brain. Okay, but we all know that in the real world, accidents can happen, even when we do everything right. So what do you do if your PPE gets torn or you have an exposure? Knowing this protocol is just as important as knowing how to put the gear on. The protocol is actually pretty simple and direct. Step 1, immediately wash or flush whatever area was exposed. If it was a needle stick, you use soap and water. If something splashed in your eyes, you flush them out. Step 2, record it to your supervisor right away. Do not pass go, do not wait. And step 3, follow your facility's specific policy. And I really can't stress this enough. Time is of the essence. Reporting an exposure immediately isn't about getting in trouble. It's about protecting your own health. For some really serious bloodborne pathogens, the preventative treatment has to be started within 24 hours to even be effective. So you see, reporting quickly is everything. So there you have it. You've mastered getting into your PPE fortress. But getting out is just as critical. In fact, taking the gear off, or doffing, is actually where most contaminations happen. It's a whole different sequence designed to keep all those germs contained. So what do you say? Should we break that down in our next explainer? If you found this guide helpful, do me a huge favor and hit that like button, share it with your friends and classmates, and make sure you subscribe for more nursing explainers just like this one. And hey, for all you studying for your boards, check out the description below. I've put links to our summarized NCLEX revision books that can really help you out. Thanks for watching and stay safe out there.